Well, you practiced cardiology for 25 years, right? I mean that, and I mean traditional cardiology. And then what clicked for you? Like, what was that pivotal moment where you just said, "I think we need to do some things differently"?
It was when my mom died of sudden cardiac death 4 months after her coronary angioplasty in New Jersey, where I grew up. And that's the thing. I was doing the angioplasty, atherectomy, stent implantation, doing it every day, morning till night. But it drove home to me just how inadequate what I was doing. And you know what? It was a very exciting time. It was the 90s, and this was the Wild West of heart procedures, and we were doing all kinds of crazy new things. And then here my mom dies of, and so I asked, and wait a minute. So what I'm doing is grossly inadequate. And I asked, what could I have done for my mom? A year, 2 years, 5 years ahead of time to have given her warning. Where, of course, the conventional answer is stupid. It's look at her cholesterol, which tells you nothing. It should have been abandoned decades ago, but it makes much money for the pharmaceutical industry. Most of our colleagues cling to this ridiculous idea that cholesterol reduction reduces heart disease risk. Of course, it's ridiculous. It does not. Statin drugs are an absolute waste, despite having made hundreds of billions of dollars for the pharmaceutical industry. And so it was that. And then I started getting involved in this is back 35 years ago. This is a long time ago. Back then, it remains largely true today. If your patient says, "Hey, my dad had his first heart attack at age 56, I'm 51. Is that in my future?" And you say, "Well, your cholesterol's fine, or it's too high, we'll give you Lipitor." Those are meaningless. But they have a coronary calcium score or a CT heart scan to generate a coronary calcium score. That's still a very excellent test. It's been around for over 30 years. I set up one of the first ones in the Midwest, first one in Wisconsin, 30 some years ago. And it tells you when you look for hidden heart disease in people who are going to work, riding their bike, going whatever, you find it everywhere. Unfortunately, what my colleagues are looking for is not early heart disease they can't do anything about. They want heart disease that leads to procedures like heart catheterization, stent implantation, atherectomies, bypass surgery, implantable defibrillator, all that kind of stuff, because that's where the money is. And that's what the problem in cardiology in particular. It's among the most cutthroat, money-hungry professions there is. And as I saw this, and I saw how ineffective there's a time if you're having a heart attack, you need a procedure. uh, but if you're just going to work and feeling fine, you don't need a procedure. And by the way, it's still done every day. A lot of my colleagues are unscrupulous, and they'll take nice people who just have no symptoms but have some measure of hidden early heart disease, and they'll put them through procedures because they use fear. This is true not just in cardiology, but in general in healthcare. They use fear. Fear of cancer, fear of dementia, fear of heart disease, fear of death. And they'll use that as the leverage to get you into the hospital for procedures or some other test. It shouldn't be that way. People should be empowered to take care of their own health. The doctor should be the benign guidance for that. But unfortunately, that's not true for the vast majority of mainstream physicians. But this is, once again, this is why what I think you're doing, what I'm doing, Hope, is so valuable because people need to hear these things because it's not coming from conventional doctors and it's certainly not coming from the media.
Maybe if you took some L-reuteri and made it freely available to the medical profession, maybe some of that fear would strikingly become greater empathy and love. And I mean, maybe that would be a partial solution.
We're trying. We're trying.
So that's interesting. So just your own. I love that. I mean, most of the I use the word functional. I don't like that word because I mean functional medicine is the kind of the buzzword of the probably the last 10 years of it used to be alternative medicine and integrative medicine, and they just keep changing it. The marketing just keeps changing around it. But in my opinion, it's really just doctors who have great empathy, who have great curiosity, and who just want what is best for the patient. And so they're willing to do things that maybe aren't part of a standard of care. They're willing to look differently and ask different questions. And most of I'm not a medical doctor, I'm a chiropractor by trade, but most of the medical doctors I know that get into this realm are cardiologists. And I don't know, well, maybe choosing to go into cardiology is heart-centered. Maybe I don't know, but I just find that interesting. That's just my own observation of people that I know in my world. Um, so let's talk more about reuteri because there's some other, I want to backtrack to some questions that I didn't get to ask on it, and that is dosing. So you're seeing again increases in skin thickness, you're seeing reduction in body weight, reduction in waist size circumference, increase in lean muscle mass or youthful muscle restoration. What kind of doses are we talking about here? 5 billion, 20 billion, 100 billion units?
One of the great holes in the entire world of the microbiome is lack of formal dose response evidence. So, for instance, there's a very nice study using another microbe, Lactobacillus gasseri, and they were looking at waist circumference. So, placebo, no change, no surprise. 1 billion per day, no change in waist circumference. 10 billion per day, 3 centimeters, about an inch and a half of waist circumference. No change in diet or exercise, just take gasseri. Well, if 10 billion achieved 3 centimeters, what would 50 billion do? What would 100 billion? What would 500 billion do? So we don't know. So because those kinds of added arms, we say, to these clinical trials adds a huge amount of cost, and we're not pharma. We don't have billions of dollars to spend. And so what I think is going on is with the products I formulated have the Gut to Glow has 40 billion in 4 capsules. The My Reuteri has 10 or 20. There's two different products, billion. And those seem to be generating a lot of positive effects. I don't think they can do, though, is one of the effects of reuteri, because it colonized the small intestine and produces bacteriocins. And so you can push back SIBO, small intestinal bacterial overgrowth. But I think that requires higher counts. So one of the options that people have is to take either of those products and make yogurt out of it. It's not yogurt, looks and smells like yogurt. It's not the stuff in the store. So we used my method of prolonged fermentation. So if you buy yogurt in the grocery store, one, different microbes, one. Two, they use very brief fermentation times, 6 to 12 hours. Well, reuteri doubles every 3 hours at human body temperature. So if we did it for 6 hours, you got nothing. So we're going to ferment it for 12 doublings or 36 hours. And when we count the number of microbes, it's about 300 billion per half cup or 120 milliliter serving. And I think those are the numbers that stack the odds in favor of eradicating SIBO. But you can even go further. So I asked this question with SIBO because it's everywhere. It's everywhere. So if you took a commercial probiotic off the shelf for your SIBO, because you're having fibromyalgia, restless leg syndrome, food intolerances, depression, anxiety, whatever, all those things are all SIBO related. If you took a commercial probiotic, will the SIBO go away? No. So what if we chose instead microbes that colonize the small intestine? Very few do that. And microbes that produce bacteriocins, effective in killing fecal microbial species. So I chose Lactobacillus reuteri, our friend, Lactobacillus gasseri, very similar, small intestinal colonizing, bacteriocin producing. And I've debated how necessary the third one is, which is currently Bacillus coagulans, but similar. It's a spore former. It germinates in the ileum, the distal small intestine, and produces bacteriocins. Well, so we either co-ferment them together, all three. One of the things we don't know when you co-ferment multiple species, what happens with each subsequent batch made from a prior batch. We've not done that analysis. We will do that. In other words, if you start with, let's say, your microbes, and then you ferment for 36 hours, you probably have somewhere in the order of 100 billion of each of those three. But what about the fifth batch? Or the 10th batch made from some prior batch, because microbes compete with each other and there may be shifts in the relative numbers of each. So we've not done that analysis yet. Some people, to get around that, they individually ferment each and eat a little bit of each rather than co-ferment them. But either way, we're seeing 90% of people normalize their breath hydrogen gas. That's how we measure SIBO. I don't have it here. I'm in the office right now. But if I was at home, I'd show you the AIR device in case your listeners don't know about it. It's a little consumer device that measures hydrogen gas in the breath. You don't need to do that, but it can be helpful to measure hydrogen gas. It's a device that essentially you can use to map where microbes are living in the GI tract. Are they in the colon where they're supposed to be, or are they in the stomach, duodenum, jejunum, and ileum where they don't belong? And you can use that device to measure. And by using that device, 90% of people who've done this SIBO yogurt idea have normalized to normal breath hygiene gas.
That's fantastic. I mean, the traditional, I think the traditional treatment for, positive gas test is rifaximin, antibiotics. And, as we started this conversation earlier, antibiotics are potentially one of the reasons why we see an absence of reuteri in the first place. So,
Exactly.
and other species as well. But that's interesting to see that it always goes back to that, doesn't it? It's something natural, something that should be there that's not there, creates a downstream effect that leads to a diagnosis, that leads to medical treatment that oftentimes caused the problem in the first place or contributed to the problem in the first place. It's like a never-ending cycle. So you're seeing SIBO and SIFO improve as a result of it. Is it more of a combination of the two, the Gasseri and the reuteri?
I think so. We have had a lot of people get rid of their SIBO by H2 breath mint just with their reuteri, though it seems to take longer we usually use it for 4 weeks as the SIBO yogurt. With reuteri alone, it seems that a lot of people seem to get relief also if they take it over an extended period, like 8+ weeks.
Okay.
And it's just a yogurt. And by the way, I kind of regret calling it SIBO yogurt because it sounds like it made it sound as if it's only useful during SIBO when it's actually restoring microbes that we should have had all along anyway because it has such spectacular positive effects. So even after somebody eradicates their SIBO, maybe their food intolerances go away, or the fat malabsorption, fat droplets in the toilet goes away, or their restless leg syndrome goes away, or their fibromyalgia goes away. I still encourage people to consume the yogurt, or at least the reuteri, several times per week, 3 or 4 times a week, chronically for the rest of your life, because it prevents recurrence, at least until we figure out how to make it take up long-term residence or permanent residence. That's one of the fundamental questions we don't have answered. That is, if mom gave us reuteri at birth, by passage through the birth canal or breastfeeding, we'd have reuteri for a lifetime, barring exposure to antibiotics and other factors. But when you get it through yogurt or probiotic, it's present for a few days, maybe a week or plus, then it's gone. But why? Well, no one knows, but I think it's because of the lack of the community that supports that microbe. So I would maybe in a few years we'll say, all right, don't just get the reuteri, get reuteri with these 6 other species, and it will take up permanent residence. But we don't know what that looks like just yet.